Hello, everybody, and welcome to the section of Chronic Disease Prevention and Health Promotion webinar series. My name is Ann Potempa, and I'll be facilitating our talk today. We're pleased to be offering this webinar series on the third Tuesday of the month at 1 p.m., and we'll be covering a host of topics. In addition to sharing our work with you, we hope these webinars will spark your interest in learning more about our projects, as well as opportunities for collaboration. Other ways you can stay connected to our work is through our monthly newsletter. You can sign up for this on the section's website. Our website address is at the bottom of all of our slides. Before we get started, there are just a few housekeeping items I wanted to go over. Please mute your phone. Also, please do not put this call on hold. Rather, if you receive a call, please hang up and call us back later. The presentation today is about 20 minutes long, and there is 10 minutes at the end for discussion. Next slide. The audio for this webinar should be coming through your computer or through the telephone number that was provided for you. If you have technical difficulties during the webinar, please let us know by using the question panel in your sidebar. You should have a section that looks like this on your sidebar. You will need a microphone on your computer, or you'll need to use the telephone number provided to ask a question out loud. All questions, except for those about technical difficulties, should be held until the end of the presentation, and then we will have more time to discuss them. To join the conversation or to ask a question, please raise your hand. We've got a picture up here to show how to do that. On the sidebar, you should have a yellow hand that you can press on. When that's raised, we'll start answering questions in the order they were asked. Before we get started on today's topic, I wanted to just give a brief description of our work in chronic disease prevention and health promotion. Our vision is for healthy and safe Alaskans, and our mission is to identify and advance the conditions that lead to safe and healthy lives. The primary aspects of our work include health promotion, chronic disease and injury prevention, and data collection and surveillance. The icons you can see here represent a few of our programs and projects. With that, I'm going to pass the microphone over to Wendy Hamilton, who will be giving our presentation today.
Thank you. Next slide. Can you hear me?
Yes, and we have advanced your slide.
Thank you very much. Okay, well, welcome everybody. As Ann said, today's webinar will be an overview of the school health program in the section of chronic disease prevention and health promotion. My name is Wendy Hamilton, and I am the school health program manager. The objectives for this session are to describe all the different components and aspects of what makes up a school health program, to describe why school health is so important, and to describe how and why school health has to be a collaborative process. Next slide. So what is school health? It's many, many, many things. It's a broad umbrella term that includes good nutrition, physical activity, physical education, comprehensive health education. Next slide. It also includes social-emotional health, which is providing a supportive environment that teaches emotional literacy as well as academic literacy, school counseling, building resiliency, school nursing, and school-based health centers. Studies, including a recent one in Alaska, show that if a child who isn't feeling well goes to the school nurse, there is a higher likelihood of them being returned to class rather than being sent home. Next slide. And it also includes school safety, which is a broad term, creates emotionally safe and physically safe schools, and then school environmental health. Next slide. And it includes school employee wellness, family engagement, and community involvement. So as you can see, there's many different aspects and components to a school health program. Next slide. Schools are busy places. Education officials do care about student and staff health and wellness, but competing priorities take precedence, such as achieving high academic test scores for their schools, teaching the common core subjects such as math, English, language arts, and literacy, their dropout rates, behavioral problems, social service, special education, and staff concerns, just to name a few of the issues facing your typical school. Next slide. The original school health model, used for over 25 years by the Centers for Disease Control School Health Branch, was the coordinated school health model with 8 components. And you'll see I've already listed and described many of these. Many states received grants from the CDC to promote this model. Even though Alaska never received a coordinated school health grant, the school health program promoted the model and patterned the growth of the school health program along these lines by creating collaborations and building a network of partners. Next slide. In recent years, the CDC and a leading global educational organization called ASCD, in collaboration with key leaders from the fields of health, public health, education, and school health, created the whole school, whole community, whole child model of school health, or what we call the WISC model. This is now the model being promoted in the school health field. The purpose was to combine public education and public health in a more unified approach. Next slide. And it was based on these premises that public health and public education serve the same children, often in the same settings. The WISC model focuses on aligning the common goals of both sectors and promotes a collaborative approach to learning and health. Instead of looking just at the academic success of students or just the health of students, they focused on combining their efforts, resulting in the creation of the whole child approach. And there's a couple of links there to the CDC website and the ASCD.org website. Next slide. So this is a busy slide, but it's a very good one. And this is the new WISC model that has 10 components instead of the 8 components of coordinated school health. I'd like to make note first of the 5 components in the middle that we'll come back to, which is healthy, safe, engaged, supported, and challenged. And as you can see, encircling the entire model is the community. So the changes are, it separates healthy school environment into physical environment and the social and emotional environment, or what we call the school climate. We know much more now about the importance of healthy school physical environments, such as clean air, clean water, being free of lead, radon, and other environmental hazards. We've also understood for years the need for healthy social and emotional school environments. It also separates family and community involvement into 2 components, and adds the word engagement to family engagement. The WISC model strongly encourages family engagement at the school, in the classroom, on the playground, and with their children's activities, so that schools become a part of the community and the family, not just an institution where you send your kids. There are 2 additions in the WISC model as compared to the coordinated school health model: adding physical activity to physical education. This is a very important addition because it emphasized the importance of physical activity outside the PE class, such as recess, recess before lunch, non-competitive, non-intramural before and after school activities, and a concept called active classrooms. and it adds the word environment to nutrition services. This adds the dimension of the entire lunchroom environment, including the new changes in smarter lunchrooms, providing healthier food, making healthy food the easy choice, taking down lunchroom advertising for unhealthy eating establishments, and providing longer than 20 minutes to get and eat your lunch. Next slide. So here are the 5 components, abbreviated: healthy, safe, engaged, supported, and challenged. Next slide. There are many, many, many quotes about health and education, but I chose this one. So why is school health important? Clearly, no knowledge is more crucial than knowledge about health. Without it, no other life goal can be successfully achieved. As you can see, it was written in 1983 by the Carnegie Foundation. We know this intuitively, yet we need to work on integrating teaching health and modeling healthy behaviors into our schools and keep a dual focus on health and academics. Next slide. So again, why is school health important? Schools are the perfect setting for teaching and modeling healthy behaviors and healthy thinking. Approximately 95% of all U.S. children and youth attend school. So schools are one of the most efficient systems for reaching children and youth to provide health services and programs. Integrating health services and health programs into the day-to-day life of schools and students represents an untapped tool for developing the whole child and for raising academic achievement. We know that learning and health are related. In fact, they are interrelated. One might even say that they are symbiotic. Where one succeeds, that success feeds the other. In addition, healthy students grow into healthy adults, reducing the prevalence of chronic disease and the burden of chronic disease that places on our society. And finally, healthy adults raise healthy children. Next slide. So, health and academics are 2 sides of the same coin. Next slide. So let's look at academic achievement a little bit. These are what's very important in the educational system. There are 3 aspects to academic achievement, as you can see: performance, behavior, and cognitive skills. All of these aspects are important. However, the items highlighted in red are the most important educational outcomes that educational institutions care about, and they are also the most important health outcomes that can happen from creating healthy students and healthy schools. If students are not attending school, having behavioral problems, and dropping out, we know those students will have a more difficult time succeeding in life as adults. Next slide. So this is another busy little slide, and I'm just going to quote a couple of things on it that I thought were interesting. However, I want to emphasize that this is just one example of one component of school health that shows positive outcomes. We could take a look at any one of the 10 components and see very similar positive outcomes. So physically active kids are 20% more likely to earn an A in math or English. And that's important because those are considered part of the Common Core subjects. To have an increase of 6% over 3 years in standardized test scores. And under the little section called More Results in the lower right, it says after 20 minutes of activity, students tested better in reading, spelling, and math, and were more likely to read above their grade level. And after being in a physically active after-school program for 9 months, memory tasks improved by 16%. And you can also see the brain scan there after 20 minutes of sitting quietly and 20 minutes of walking, a more active brain. So more examples of this in other components are that research indicates that students with involved families are more likely to earn higher grades and test scores, attend school regularly, have better social skills, show improved behavior, and have higher graduation rates. Student participation in school breakfast programs have been shown to be associated with increased academic grades and test scores, reduced absenteeism, and improved cognitive function. When working in an educational setting, it is very important to show these connections when you're promoting health, because as we saw in the slide earlier, schools are busy places and they have to prioritize what they are held accountable for, which is test scores and graduation rates. Next slide. So as I've mentioned, school health is a collaborative process. Therefore, the Alaska School Health Collaborative was formed several years ago. Its purpose is to stay informed, connected, and updated with each other. We also address emerging issues in school health and look for opportunities to share resources. The Department of Education and Early Development is our key partner. Education and health must work together to increase school and student health. And these are just a few of the programs in the Department of Education. Next slide. Within our own Department of Health and Social Services, we have several partners. Under the Division of Behavioral Health, Substance Abuse, we also have underage drinking, and now the issue of legalization of marijuana. And in the Division of Public Health, in our own section, we have obesity prevention, tobacco prevention, and data and surveillance. Addressing obesity, tobacco use, and all substance abuse while students are young has proven to be the most effective stage of life, while their brains are growing and when lifelong behaviors are being created. And then, very importantly, we have our data and surveillance systems, which let us know if what we are doing is working and highlights emerging health issues such as e-cigarettes. Next slide. Continuing in public health, we have the Section of Women's, Children's, and Family Health, which has school nursing, school health, the adolescent health program, and in the section of epidemiology, school environmental health. We also have many, many non-governmental State of Alaska agencies and national organizations that we collaborate with in our goal of promoting school health in Alaska. Next slide. So I think one of the most exciting achievements of the School Health Collaborative has been the yearly, now it's in its 10th year, Alaska School Health and Wellness Institute, which is a rich and diverse professional development opportunity. Attendees include teachers, school nurses, school counselors, school principals, district superintendents, public health nurses, school administrators, student health agencies, and family and community agencies from around the state. The theme and the title for the last 5 years has stayed the same: Healthy Students, Successful Students. Next slide. So there's still time to register, online or on site. It starts next Monday. It's the 26th through the 28th at the Captain Cook Hotel. you'll see the website link at the bottom. It'll describe the full agenda. We have multiple topics each year, and we provide certified nursing educational units, CEUs, which are professional development credits. Those are provided through the University of Alaska, Anchorage. Next slide. One aspect of the SHWE we are especially proud of, and that is precisely because it is of our many school health partners, we are able to offer multiple scholarships types each year. Many school districts don't have enough money allocated for professional staff development, especially in school health, and especially in the smaller, more rural districts and schools. We target rural schools. This year we have scholarship recipients from Port Protection in the Southeast Island School District, Mountain Village in the Lower Yukon School District, Barrow and Anatuvik Pass in the North Slope Borough School District, Nome, Metlakatla in the Annette Island School District, Manakotak in the Southwest Regional School District, and Bethel in the Lower Kuskokwim School District, as well as all the larger urban school districts are represented. Next slide. Another example of collaboration between partners was the creation of the State of Alaska Gold Standard Wellness Policy. The Obesity Prevention and Control Program, the School Health Program, the Alaska Native Tribal Health Consortium, and the Alaska Department of Education and Early Development wrote model policy that meets all the updated federal requirements and more of a school district's wellness policy. They then worked with another one of our partners, the Alaska Association of School Boards, to negotiate adoption of a wellness policy version that went above the federal requirements. And again, there's the link for our gold standard. You can also find the gold wellness policy on the school health website. Next slide. And that's the main page of the school health program. We have many topics available at our website. There's a long list of further resources on this main page, including partner links, journal articles, and nationally produced documents describing the importance of school health. Next slide. So again, there's the link for the school health program, and there's the link for the State of Alaska Gold Standard Wellness Policy, which all districts who partake in the National School Lunch Program must have a district wellness policy, and they've just updated the requirements of that. So the State of Alaska Obesity Program took advantage of creating a gold standard policy to assist districts in adopting the best policy possible. Next slide. To stay informed, you can join the School Health Listserv at that web address. You scroll down the page to School Health and click Join. There's many other listservs available, including the Nutritional Program, School Health Nursing, Adolescent Health, and Obesity. Next slide. This is my contact information, my email address, and my phone number. So thank you again for attending, and I'm happy to take any questions at this time.
Please raise your hand if anybody has any questions for Wendy about school health or working with Wendy on school health promotion. Wendy, as we wait for questions to come in, can you talk a little bit about how organizations or other groups can work with you to promote school health?
Yes, thank you, Ann. Well, first of all, if an organization is interested in getting involved in school health, please just contact me so that I can learn what type of organization it is, what they're interested in, what they want to learn about and possibly what they have to offer to the school health collaborative. As I said, there's so many different aspects and so many different interests in it that just contact me and let's see how we can work together.
Great. Thank you, Wendy. Another question has come in from Diane Peck.
Hi, Wendy. I was wondering how somebody might learn more about the WISC. Is CDC going to be doing any training, or have they been doing training? Is the state going to be doing any training?
Thank you for asking, Diane. There's two links in this slide presentation that'll basically describe the new model. We have a keynote speaker we're very lucky this year to have at the School Health and Wellness Institute. The first day, the keynote speaker is Holly Hunt, who is chief of the school health branch in the Division of Population Health at CDC. And she has two topics, and one will be this new model. There's no training that I know of, just education around it. It's promoting an idea and a concept rather than a how-to.
We have a question that came in from Mr. Peterson asking if he will receive a copy of the presentation as a PDF, and the answer is yes. Within the next week, what we typically do is we upload the presentation as a PDF, as well as the video. We will be uploading the video webinar, and we'll be doing that on our webinar website that is part of the initial email that you received. And I will be sending out an email probably in the next week letting you know where those links are. So yes, they will be coming. We have another question from Claire. We're going to unmute you if you want to ask your question. Claire, I think you're unmuted. Let me know if, oh, here she is.
I can't unmute her.
Oh, Claire, we're having trouble unmuting you. Do you have the ability to type your question online? If you can, try to type it in. Oh, here it is. Okay, great. Claire, I can see that you say you can type. Can you type in your question for us and we'll answer it for you? While we're waiting for Claire's question, oh, here it is. I'm wondering about incorporating more Alaska-based foods into the school lunch diet. Wendy, can you address that at all?
Oh, certainly. That is an aspect of school nutrition. That's a whole sort of a sub aspect. There's a farm to schools program. There's a fish to school program. And again, if I may tout the SHWE again, we're going to have a presentation on 2 new cookbooks. Diane Peck will be part of those presentations about incorporating Alaskan foods and Alaskan recipes into the school nutrition program.
She did ask, Wendy, additional questions about doing this with discounts or state funding. Is that something you can address?
Doing what?
Incorporating more Alaska-based foods using some sort of discount or state funding.
Boy, that's a very technical question. I would refer that to the Department of Education School Nutrition Program, or I'm sorry, Child Nutrition Program. Joe Dawson at the Child Nutrition Program at the Department of Education would know more about that.
Thanks, Wendy. We have another question in from Jennifer Baker. How has this model been applied with the youth in foster care, in alternative schools, and in juvenile justice facilities? And if so, have these locations incorporated quote-unquote parent engagement? Is that something you can...
Not that I would say, to my knowledge, they have not been incorporated. Certainly those are organizations, educational organizations for youth that definitely need to be addressed. Alternative schools, however, are definitely being addressed. The Department of Education and Early Development has gotten specialized funding for alternative schools. In fact, now every alternative school in the state will have not every, 10 of the larger alternative schools will have a school counselor in the alternative school. So they are not separate from what we consider educational organizations. They are just funded under a different program which provides funding for more specialized care such as graduation, social, emotional issues, social services, and behavioral issues.
Thank you, Wendy. I'm not seeing any more questions come in, and we're hitting our 30-minute mark. Like I said, this presentation will be posted online soon. And you also have Wendy's contact information here at the end. Again, it's wendy.hamilton@alaska.gov or 907-465-2768. And I'm sure she'd be happy to answer any more of your questions. Thank you, everyone, for your time today, and we look forward to another webinar a month from now. Thank you.